Join Dr. Gerald Thompson, physician, specialist, and notable environmental conservationist, every Wednesday, 8 to 9 p.m. here on WeFM 99.9. Your health matters. Ask Dr. Thompson any burning question you have related to health. Your health matters. Dr. Thompson will examine healthcare, highlight important environmental issues, and look at what's hot in science and technology and the next wave of emerging diseases and health trends. So this and every Wednesday, join us 8 to 9 p.m. here on WeFM 99.9 because your health matters.
People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
And good evening. This is Your Health Matters. This is Gerald Thompson, Dr. Gerald Thompson, your host. And I'm really pleased to be in this evening. Outside is so nice. Kamal, you're tied up here in this studio, but outside, it's so breezy, it's so calm. The air is crisp, sweet. It's the kind of evening I like. But this evening, we are going to talk about asthma. Asthma. But before I go into it, I want to tell you that it's a long time since we've spoken about COVID. And these days, people don't want to hear about COVID. You hear about COVID, people cork their ears. Come on, I know you cork your ears. You put on the earphones and so on. But I've been gotten a couple of calls today and so forth. And in certain other countries, it's something that we do still have to be worried about. As a matter of fact, ever since April of this year, a group of new virus strains known as FLIRT, the FLIRT strains, F-L-I-R-T. No, ask me, babe. But these have been making a resurgence. It's amazing how COVID has been mutating and evolving compared to the time when we used to talk about Delta and Gamma and all. Remember those days, Kamal, or you forgotten that? Those were deadly viruses. These viruses typically don't tend to cause a lot of death. But what they do, typically, we've been seeing in a number of countries, or if you're listening, not necessarily only in St. Vincent, episodes of what we call continuous coughing. This means coughing a lot more than an hour, half an hour, or 3 episodes of these more prolonged coughing spells in a 24-hour period. And that we're still seeing some persons still having a loss of their taste and smell, a loss of their senses of taste and smell, because the nerves that control these to the back of the throat and so are being affected by the virus and so on. But this coughing is associated with shortness of breath, feeling tired, feeling fatigued and exhausted. And I want to just say, if you have a hard time breathing, that is a sign you may be having an ordinary flu, but who knows, it may be COVID. And you or a family member who is affected should contact a medical provider. And that if you have underlying conditions, diabetes, high blood pressure, sometimes, boy, with these things, your sugar just goes out of control. Your pressure just goes sky high. And These are the real emergencies that we have to address and may need even hospitalization. But I just wanted to mention that as something of a starter for my subject today, asthma. And a couple of people have been asking me, Doc, what causes asthma? What causes asthma? Well, tell you for a number of things. It can be having a family history. That's a yes, a family history. If you have a parent with asthma, you are 3 to 6 times more likely to develop asthma than someone who does not have a parent with asthma. That's the first thing. The second thing is allergies. Certain type of allergies. I'm talking about to grasses and hay fever and those sort of things. Then, besides allergies, which comes from pollen, the pollen of the flower inside the flower of a plant. Instead, a third type is a viral respiratory infection. A virus, and guess what? It could be COVID, it could be flu, it could be all kind of different viruses. Many, many different viruses can cause influenza, this, that, and the other. But viral infections can induce asthma. And then occupational exposure. Do you know you could be exposed during your place of work to certain chemicals, whether it's bleach, whether it's some kind of perfume, whether it's some kind of something in the workplace is triggering your asthma. Then, of course, a big one, smoking. Oh, gosh, man. If you have asthma, should you be smoking? Well, there's some people who do, right? And then, do you know there's some places in the world? I'm talking about Tokyo, Los Angeles, certain cities, big cities in the world where the air pollution level, the amount of dust particles and chemical particles in the atmosphere you breathe, it's just like inhaling triggers for your asthma. And then another important one is obesity. Do you know a lot of people who are obese also tend to have asthma? So this is the long list, and each of these can be independent. But what if somebody has what if somebody who's obese and they have a family history of asthma and they've caught an infection, but they live in a city that's highly polluted and they smoke? You know what I mean? That is not just a double whammy, a triple whammy. That is really inducing a lot of things, for yourself. Strangely enough, the most common factors for developing asthma are having a parent really with asthma, or having some sort of family history, or having a severe respiratory infection as a child, and these kind of allergic conditions. So what really causes asthma? And scientists continue to explore what the triggers and the cause are, but we do not know that these factors play an important role in really development of asthma. And let's just go through. Now, family history, we mentioned that, allergies. Now, some people are more likely to develop allergies than others, especially if also there's a family history of allergies. Certain allergic conditions such as eczema or allergic rhinitis, we call hay fever, are linked to people who also get asthma. Those conditions are not asthma, but they're linked to people who get asthma. And then we've spoken about the viral respiratory infection, occupational history, smoking, air pollution, and obesity. And that's all really important. But asthma is a chronic condition. In other words, you have to virtually live with it every day. It can be serious and even life-threatening. And there is really no cure for asthma but it can be managed and it can be controlled. That doesn't mean that you've had asthma doesn't go away, but it isn't necessarily a cure. But some people say I was cured, but really and truly, there's no known thing we can give you to cure it. It can go away on its own. So asthma is this chronic lung disease that causes changes in your breathing system. And it's really interesting to know what really is inside your chest. If you were to look at me here right now, when I open my mouth and I breathe in, at the back of my throat, there are two tubes. One of the tubes goes down to my food pipe, and the other goes down to my windpipe. Back at the back of your throat are two tubes. One, it goes down to your food pipe, your esophagus, and the other goes down to your windpipe. And there's a little piece of flesh that hangs over the windpipe so that when you eat food, it covers over the windpipe so food doesn't go down. But have you ever been eating too fast and you swallow a nut, a peanut goes down or you eating fish and the fish, something goes down. Well, the fish bone normally gets stuck in your food pipe, right? But boy, a nut, a peanut getting stuck in your windpipe, you got to, as a matter of fact, it is a very interesting cause of death. Kids in particular, playing marbles, playing with sweets, swallow, have a sweet in their mouth, but they start to laugh. Because somebody fall down and they laugh and find that whatever was in their mouth has gone down into their windpipe instead of their food pipe. And boy, if that thing gets stuck going down there, somebody has to come and do what's called a Heimlich maneuver. They have to squeeze the belly so as to push up the belly onto the lungs and expel that sweetie, that M&M that kid has swallowed. I've had to do that a couple of times, and it is very important. But as from the windpipe, that windpipe branches. It branches over to the left and into the right. One branch goes to your right lung, the other goes to your left lung. And just like a tree, consider to be like an upside down tree. It branches and branches and branches and carries air all the way out to the lung tissue that is there. And when you breathe in, air goes into your lungs. Some goes down the right side, some goes down the left side, and into the branches of the lungs so as to bring oxygen to you. When you breathe out, you're breathing out some carbon dioxide that's been taken from the blood and so on. I'm not going to get into that, because what's important to know is that these branches of your windpipe and your airways, bringing it, have muscles in them. They also have a lining, a mucus lining, and they have muscles. And what I want to explain to you is that sometimes those muscles can be sensitive. You understand that? Muscles in your airways can be sensitive. In that pollen, in that allergies, in that smoking, pollutants in the smoke, pollutants in the air can trigger these little muscles to contract and make your airways seem smaller. So the amount of air passing into your lungs is less. And because air is passing in and is less, and it's moving at a fast speed, you can hear a wheezing sound. You know, wheeze, you know. Hard to describe it because I don't have asthma, but it's really fascinating. But you have to know that asthma is predominantly created by the lining or inside those airways swelling, and by the muscles inside or around the airways contracting and getting tighter. This is not good. So that during an asthma flare-up, the insides of your airways swell even more and can produce extra mucus. And this narrows the space for the air to move in and out of your lungs. The muscles that wrap around the airways also can tighten, making breathing even harder. And when that happened, it's called asthma, an asthma flare-up, an asthma episode or asthma attack. And after an attack flare-up subsides, or takes place, you may feel tired. You may feel tired, partly because you haven't been getting enough oxygen into your body in the first place. And two, your chest has been working hard to breathe in and also to breathe out. Because if the airways are narrow, breathing in is tough, but getting the air back out of your lungs is also tough. And you got to squeeze the air out, and you got to pull the air in. And boy, that takes up a lot of energy. And so people have to try and avoid asthmatic attacks. Now, it's interesting to know that people who have had asthma for a long time, their lung structure starts to change. It starts to change from normal. So poor asthma management can lead to a kind of a remaking or remodeling of the whole lung structure, And this is a serious condition that happens with asthma that's poorly managed. The lungs start to become scarred from all this hard work and swelling and muscles and so. And it make it harder for the asthma medicine that will help to reduce the swelling of the mucus and also to relax the muscles. It becomes harder for the medicine to work. Could you imagine an asthmatic who's been taking medication for a long time, finding that the medication they're taking can't work, isn't working? Boy, that creates anxiety. That creates a lot of panic. And it is, a big problem. So living with chronic lung disease like asthma makes your lung even more sensitive than people without asthma. 18% of adults with asthma also smoke. Kamal, do you believe that? And it is a sad situation because cigarette smoking is the number one cause of preventable death around the world. And the cigarette smoke just irritates. I say it isn't just the smoke itself. You won't imagine the amount of chemicals inside that smoke. All sorts of different compounds. The heating of them changes the compounds, breaks off compounds to form other compounds. And these irritate the lungs, causing redness inside the lungs, swelling, and more mucus. And your lungs have a special natural defense to keep dirt and germs out, right? But cigarette smoking destroys some of the lung tissues and breaks down these defenses. In other words, do you know that inside your lungs, the airways, let's say the streets and the roads inside your lungs are lined not by pitch, but by mucus. And this mucus is constantly being moved out. And if any dirt collects on it, that comes up. Guess what? The mucus comes up to the back of your throat, and without you knowing, you end up swallowing it. Subconsciously, mucus is constantly coming up from your windpipe, bringing dirt. It's a lot like washing your lungs and a conveyor belt, and bringing dust and dirt that you breathe in that's stuck to the mucus. And it brings it up and dumps it over into your food pipe without you knowing. Now, when plenty come up, you could feel it in your, you clear your throat and you swallow or spit it out. You know what I mean? Come on, you had that? But it's done subconsciously. Most of it you swallow and it goes back down in your food pipe because we don't like spitting everywhere. If you're inside a studio, you don't have a spittoon, you don't have somewhere to spit, and your tissue, I don't see a whole set of tissue paper on your, that's not considered to be hygienic. So the way the Lord made us is that we naturally dump the mucus back into our food pipe without having to use tissue paper. It's only when it becomes excessive, you know? Now, people who smoke cigarettes, that whole conveyor belt system of getting milk is damaged. It's damaged. And the conveyor belt ain't working. So mucus builds up. And those people you would hear, and you hear a lot of cough. Now, you really have to learn about protecting your lungs. And it's a really important thing. Now, today, asthma really is no. I've told you about some of the causes, but there are different types of asthma. We just spoke about the causes of asthma, pollutants, cigarette smoking, all that kind of thing, allergies. But today, asthma is no longer considered as a single disease. Asthma is often categorized or broken down into many different types. And let's go back again before the break. Number one, there's allergic asthma. Allergic asthma. Then there's a special type of medication-induced asthma. I want to tell you, do you know which medication is the biggest cause of asthma? Aspirin. Aspirin. You believe that a lot of people are actually allergic to aspirin, just like a lot of people are allergic to penicillin, or people are allergic to bee stings. A number of people are allergic to aspirin, and there's aspirin-induced asthma. Then there's a special type of asthma called cough variant asthma. When people cough, for whatever reason, it helps to trigger the asthma. So in that the asthma is causing coughing, is that a coughing can trigger the asthma. Now I'm going to give you a funny one. Exercise-induced asthma. Exercise-induced asthma. There's some people who, if they exercise too much, like in the cold winter, the exercise-induced asthma can trigger an asthmatic attack. There's also something called nighttime asthma. It's people who get asthma predominantly at night. I want to say that sometimes those nighttime asthma are related to having bed mites, bed bugs. Do you know that there are mites that live inside your bed? And these mites feed on your dead skin. And they don't like you to shower before you go to sleep. They want you to jump into bed so your skin fall off. They can eat your dead skin. These are bed mites. They're not bed bugs, they're bed mites. And they love to live in pillows. And what do we do with our head on a pillow? We rest our head on a pillow and we fall asleep and we're breathing in. And the bed mites are coming out. And guess what? We are breathing in the bed mites. And they're triggering various forms of asthma. You know? I mentioned to you about allergies before. Do you know the type of allergies? They're the grasses and so. But do you know a lot of people are allergic to cockroach dust or bat dust? The bats that live in your roof, and the bat droppings are coming down through the sides of the Celitex or plyboard because they're living underneath the galvanized in the roof. And you see some granular stuff coming down. Kamal, you ever seen that? You gotta say no because you can't. You're not supposed to admit that you have bats in your roof and so forth. That's right. So Kamal doesn't know. So you know about that. But I'm explaining to you. I'm teasing Kamal there. But I'm just saying that a lot of people have bats in their roof, and the bat droppings are coming down all the time. But also cockroach dust. When the cockroach dies, or you kill a cockroach and so forth, or you spray it, those chitin, as it's called, the exoskeleton starts to break down. It starts to break up like a biscuit and comes into flour. And guess what? It floats around the air. So I know WFM doesn't have any cockroaches. I know that. But in some places, the cockroach dust is floating in the air, just like bat dust. When we breathe in, we're getting that stuff down into our lungs. Those are allergy. But I'm talking about nighttime asthma, bed mites. And then there's what they call steroid-resistant asthma. There are medication we could use to treat asthma to help dilate. But boy, a lot of asthma induces what we call inflammation. And sometimes you have to use various forms of steroids, cortisol as they call them, steroids, to help reduce the inflammation. But boy, if you have an asthma that is resistant to steroids, and you have bad asthma that's resistant to steroids, I gotta say this, death could be staring you in the face. I don't want to say it that way, because steroids are a very important measure of controlling asthma. So if somebody has a flare-up of asthma from time to time, and they've now developed steroid-resistant asthma, boy, it's tough treating you. And then there's occupational asthma. Now, we'll take a break, and then we'll come back, and we'll talk about certain other things.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Yes. Now, I just mentioned something a while ago. I mentioned to you something called inflammation. Now, researchers have started to look a lot deeper at the role inflammation plays in asthma. They believe that all people with asthma may have some degree of inflammation in their airways, in their lung system. And they may, and there's a way we can categorize this inflammation, different types of the inflammation. I'm not going to get into that detail. But, the amount of inflammation that's taking place inside your lungs can lead to a lot of severity of your asthma. So some people do not respond well to steroids, as I mentioned to you before. And when we hear the word steroids, we think as this the Olympics, something bad, you know? But steroids, our body makes its own steroids, you know, and steroids are important for keeping us alive. You don't want too much and you don't want too little. But they have steroids now in medication that you can inhale, but from a device that you could spray into your lungs directly. We have steroids we could inject into your skin that will get into your blood and eventually get to your lungs. And we could also even put up a drip, you know, some life water. But breathing in the steroids, inhaled steroids is called, is probably one of the important things. And I want to say having either uncontrolled asthma or difficult to treat asthma or severe asthma, any of these, you really have to see a physician. And we tend to ask a lot of questions. If you're asthmatic, have you had an asthma episode in the last 12 months that require you to call the ambulance or the emergency? That tells us a little about how severe. Did your doctor prescribe you oral cortisol that you're currently using in any way? Did your doctor prescribe you other medication that will help to give you a quick relief in terms of like an inhaler? And did you recover? We ask all these sort of questions, you know? And this goes a long way in guiding us as regards how serious do we treat your asthma. Because sometimes asthma can be overtreated. Somebody has an asthmatic attack. You don't want to zap them with a whole set of medication. You know, it can be too much. And then we usually treat persons and allow them to come off of it if they get better. You don't want to give somebody has an asthmatic attack, you don't want to give them for the next 2-3 years the same medication. That causes a lot of side effects. But at the same time, we cannot undertreat asthma because it will lead to chronic reshaping of the lungs. And you don't really want to do that. Are there any other sort of family chronic conditions? You know, diabetes, high blood pressure, all the things like that. And all these things are quite important. Now, why I have brought this topic up is not so much that a lot of people have asthma, or that there may not even be a member of your family who have asthma, but a lot of asthma sufferers are there quietly suffering from asthma. They don't talk a lot about it. They're a bit embarrassed. As a young person, the person may not participate in sports, in running in school or netball or athletics or football, because of the fear that it might trigger the asthma. Some people may not want to go outdoor. As a young child, you say, can you come out and play? But their mom is told you can't go out because your asthma could get triggered. But older adults can be very embarrassed by this. But it's important that if you have asthma, you let your employers know. It isn't something that your employers say, well, we're going to let you go. You all go back home. You can't work here if you have asthma. No, it's not like that. Because if you have an asthmatic attack, you often need encouragement and other people to know that when your asthma is getting very severe, they will get you to the hospital. They will get you to the hospital. Some people who have flare-ups, some patients know how to treat it. But sometimes even the patients who know how to treat it underestimate how bad the asthmatic attack is. And they haven't told many people. And they think they could go home and they think they could drive home. But on the road, they're behind a big truck with a whole set of diesel exhaust coming out. It helps to trigger them more. Or they get anxious driving home and somebody cuts them off and gives them a finger and they get upset. Or they get a phone call with some bad news. All these things can push some people over the edge, make their asthma just intolerable, especially if you're in traffic. And so it's really important that we have that. Now, people with asthma have ongoing symptoms and flare-ups. It could be a long time between each flare-up, but that doesn't necessarily mean they have severe asthma. Of more than, in any given population, about 5 to 10% of asthmatics suffer from severe asthma. 5 to 10%. If you are one of those, or if you have a relative, a son, a daughter, or somebody close to you, a good friend who is part of that 5 or 10%, you should be reading up about asthma, because what you know could help save their life, And that's why it's important for asthmatic patients to talk to their doctor, but at the same time, to have the people who are close to them knowledgeable about it. Sometimes there's medication there, but you forgot to fill it. You forgot to refill it. And you go to the cupboard to get the medication and you shake it. Come on. No medication there. And uncontrolled asthma is sometimes defined in relation to the frequency. So daytime asthma symptoms, that's shortness of breath, chest tightness, a cough for more than twice a week, we say it's uncontrolled. Waking up at night with asthma symptoms more than twice a month. Waking up at night with asthma symptoms more than twice a month. That is uncontrolled asthma. Using quick relief. This is some special medication the person could squirt into the back of the throat and breathe in. But using some of this quick relief medication for symptoms, call it Ventolin, and so more than twice a week. If you are using quick relief more than twice a week, you're uncontrolled. And if it is limiting activity such as limiting going to work, limiting doing your walking in the morning, then that is it. Now, when it comes to severe asthma versus uncontrolled, having 3 or more of these episodes or issues, you could say people are uncontrolled category. But these individuals could be better controlled by working with the healthcare doctor to improve their medication so as to make it less uncontrolled, to make it more controlled, right? Now, on the other hand, severe asthma, difficult to treat asthma. Patients with severe asthma are using the highest doses of medication. The ones that help to dilate the lungs, open back up the lungs, and the ones that having steroids. They're using the maximum amount. And they may even have other medications, such as they're taking a tablet of steroids as well. In other words, they're taking tablet by spray in the mouth, as well as they're taking steroids by spraying in their mouth, as well as tablets swallowed in their mouth. However, despite using these high doses of medicines, they are still having attacks. This is called severe asthma. And if the treatment plan is not working, it may be necessary for them to go into the hospital to get some different types of medication that will help them through the day. I am of the view that asthma is one of the most underestimated illnesses out. A lot of people take it for granted. Patients take it for granted. Relatives take it for granted. I have seen asthmatic patients die. It's one of the most gruesome things out. These patients who die are more severe asthmatic cases where the medication ain't working. And worst of all, if there is a bacteria or germ that has also started to attack the lungs and cause a pneumonia. Could you imagine having asthma, severe asthma, and on top of that, you have pneumonia? That pneumonia or bronchitis or whatever takes away whatever room and space inside the lungs there is for oxygen to get in and for carbon dioxide to get back out. Pneumonia almost fills up the lungs. It's like, imagine having a balloon. You could breathe into the balloon and you know air is inside it. But if a whole set of jelly and mucus is inside the balloon and you try and blow up the balloon, you can't get much air in. You understand? There's already a whole set of gunk, mucus, water, secretions, filling up the lungs, filling up the balloon. So when you try to breathe into the balloon, no air could go in because it's full of gunk, it's full of snot, it's full of hacking up, what is the word they use? People hack up stuff and so forth. You know, it's full of hacked up stuff. I'm using these terms, you know, just to explain properly. Imagine all that stuff down inside the lungs. And on top of that, an infection, bacteria down there causing more inflammation. Oh boy, you have to be in a hospital. And sometimes asthmatics, we have to put a tube down into your lungs to help you breathe. We have to put a tube down into your lungs to help you breathe if you get to the hospital on time. If not, you could be in some serious problem. And if somebody is asthmatic and diabetic, has heart disease, the asthma may not be the thing that actually pushes them over the hill. It may be the stress of their body on their heart, not getting enough oxygen, and their heart just gives out. The heart gives up. They get a heart attack. They go to heart failure. All sorts of things happen because the asthma was just too tough to deal with. You know, I I'm sure that in terms of today, I want everybody to understand one of the first asthmatics, you got to be able to drink some water because hydration is important. More importantly, there are these inhalers or medications that will look to open back up the lungs, relax the muscles, those muscles that have gotten tight, and narrowing the airways. You want to relax them a little bit. And now more air could pass. But that takes time. And if there's a lot of inflammation, you want to cut down on the inflammation. So we either have somebody inhale some steroids. So inhaling the steroids gets the steroids down into the lungs, directly down into the lungs. Or we can take tablets, or we can sometimes give some people some injection and so forth of steroids. But all these things are really important in terms of how they help with action. So you got to take action. We should not be having an asthmatic death. Asthma is something people should not die from. It's something that can't be cured, but it can be treated, and it can be treated in time. And we should not have asthma deaths, whether a young person or an older person. Clearly, sometimes, as I said, the person is their own enemy because they smoke or they stressed out or whatever the case may be. But, you know, asthma requires some element of respect as a disease. It needs to be managed properly, you know, and so I want everybody to start learning much more about asthma, right? And you will learn about other lung diseases, emphysema and chronic obstructive pulmonary disease, things like that. If you smoke, make a plan to quit. Make a plan to quit. Talk to experts, about how to quit smoking. And patients with any of these lung conditions, we really want you to go for it. I haven't had any calls today, right? Because I suppose asthma is a listening subject, but the things that induce asthma, is really my tablet. Oops. It didn't break. Yeah. My phone just fell out of my pocket. I thought it broke, but it didn't. I'm lucky. Yeah, real lucky. You know, so there are different degrees of asthma, severity and everything like that. But the important things that I want persons to know is that there's allergic asthma, you know, there's exercise-induced asthma, there's all sorts of asthma that can be resistant to the medication. We don't quite know why, but steroid-resistant asthma, all these things can be quite serious. And so you have to understand what triggers your asthma, and that will go a long way. There's no doubt, as I said, the things that you should. I've gone to people's home with asthma, and their homes are not fit to live in. There's dust in the corners of the rooms. They have carpets that harbor dust. There's pollen and air pollution. They may not realize that the exercise they're doing is helping to induce the asthma. Now, I am saying exercise is important, But in them, if there is exercise-induced asthma, then we got to find some other ways. The allergens, the smoke, people, the type of allergens we got to worry about. You know, the people who have food allergies, there's certain foods that will trigger the allergy. I mentioned to you, there are bed mites, there are cockroaches. I mentioned to you, there's medicines, especially aspirin. You know, aspirin. Of course, somebody who's allergic to penicillin too could induce the asthma, right? But penicillin would tend to do more if you're allergic to it. But aspirin is notorious for causing asthmatic attacks and so forth. So you got to know if you're allergic to aspirin. And then other medical conditions affecting the lungs. But really be worried about mold. Mold. Do you know, after a hurricane where there's been flooding and waters come through the house, be sure you will see where the level of water was in the house, or if a room upstairs was leaking, you see mold up the wall right up to where the level was. Be sure to find that. When you go into that room, it could be some dangerous mold. I can give you the names of some of these molds. If they go down into your lungs, they're going to induce asthma. So those rooms have to be cleaned out and hopefully cleaned out by people. You know, after Hurricane Katrina, a number of rescue people went into these places and they started coming down with illnesses, asthma, and so, because the mold that had started to grow after the water subsided. Strong odors, bleach, disinfectants, all them kind of thing could induce asthma. I didn't even mention dogs, cats, other animals, the dander, the skin, the protein in the hair and so forth. When you inhale it, the cat dust, the dog dust, it's really the skin from these animals, they can induce asthma. And then, you know, cleaning the place is so critical. We've come to the end of the program. You know, I thought there would be some calls on this in terms of persons saying that, boy, I have asthma. You know, I'm glad that it, but the important thing is, if you keep your home clean, if you get rid of them bats and the bat dust in your ceiling, if you make sure no cockroaches are around the place, so dead cockroaches, the skeleton, the exoskeleton is breaking up, going to dust and so forth. If you could follow some of these things, and if you drink a nice, healthy amount of water each day to wet inside your mouth and your lungs, you are going to reduce the incidence of asthma. If you have to be on medication, make sure you take your medications wisely. Don't let the asthma remodel your lungs and change it up. And, you know, change up the shape of your lungs and your airways and so forth. Ladies and gentlemen, we've been talking about asthma. We haven't had many calls, but I hope that I've inspired you to a better, healthy way of living. Your health truly matters. Thank you.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville